Good morning, everyone. Welcome to an episode of Coffee Break with Card, Laura, the Cafecito Sister Show. My name is Lourdes Quinones, and I would like to welcome you to the show. So come on in, sign in the comment section below, and let us know if you're joining us and drinking a cup of coffee or tea or whatever it is that you're drinking. Just let us know. We'd love to say hello to you. Coffee Break with Card is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. So again, coming in and sign in and say hi. Would love to say hello to you. In today's program, we have the pleasure of having with us Lisette Cullen, who is an educator for the Florida Poison Information Center in Tampa. And we know that this is a crucial topic for our loved ones with autism because, as you know, studies have shown that they are at a higher risk of poisoning at any age, but especially in childhood. So we're going to be discussing a little bit as to why that is. And we'll also be sharing plenty of resources, and you don't want to miss this. Join us. We'd love to say hello to you. I'd like to start by introducing to you your coffee hostesses for today. As I mentioned, my name is Lourdes Quinones, and I am a consultant assigned to the primary age group professionally. I'm also a pediatric physical therapist, and I'm also a special education educator. I am joined by my colleagues, Jasmine Castellano. Buenos dias, Jasmine.
Good morning. Buenos días, Lourdes.
Olivia McDonald is also with us. Buenos dias, Olivia.
Buenos dias. Good morning, everybody.
Yeah. And Lisette Cullen, who again is joining us for today. Thank you for being here, Lisette. Good morning. Buenos dias.
Good morning, everybody. Buenos días a todas.
Mhm. And as you know, Jasmine Castellano is an excellent professional in the field of mental health. She's a CART consultant assigned to the youth group from middle school to young adults, and is the mother of three, one of whom is diagnosed with autism. So welcome, Jasmine.
Thank you, Lourdes.
Olivia McDonald is an excellent professional in the field of public health. She is the CART consultant assigned to the primary age group, just like me. And Olivia is the mother of two and has a younger brother diagnosed with autism. So welcome, Olivia.
Thank you, Lourdes.
So we'll introduce Lisette in the question and answer section of today's show. But for the meantime, welcome to the show, Lisette.
Thank you.
Before we get started, we want to review the rules by which we want to adhere during this programming to ensure a safe environment for all of us. Remember to keep an open mind, maintain a positive attitude, and use respectful language. And Olivia, do we have anyone to say hello to this morning?
Yes, I want to say good morning to Rosa Maria. Thank you for joining us over from the Spanish show. Lisa and Vibes Learning.
Good morning. Thank you for being here. And again, like I said, we have a lot of information for today, so we have to move on fast. But for those of you who are just joining us in today's program, we have the pleasure of having with us Lisette Cullen, who is an educator for the Florida Poison Information Center in Tampa. And Lisette holds a degree in chemistry from Rutgers University in New Jersey. She worked as an analytical chemist in research and development at Pfizer and later at Coty Inc., and has over 15 years of experience as a bilingual community educator for the Poison Control Center or Poison Help here in Tampa. So join us because we have a lot to talk about. So welcome, Lisette, again to the show. But I wanted to say that besides what I just said about you and your background, and what you bring to this table, can you tell us a little bit more about yourself, something I didn't already cover?
Well, thank you, Lourdes, for the introduction. Good morning to everyone listening today. I'm very happy to be here sharing this opportunity with an outstanding team of professionals and friends. I consider all my CART people my friends. In addition to the information about my background, I would like to tell you that I have had a great passion for teaching since I was a little girl. So I've also taught Spanish for 6th through 9th grade at Hillsborough County Public Schools. And education is one of my favorite activities and I enjoy the most. So working as a community outreach educator at the Poison Control Center allows me to keep that passion alive. And it's a very interesting and rewarding job. So I'm also, besides that, on my personal life, I'm a mother of 3 children, and they're my greatest pride. I just a little bit of background for the audience. CARD USF and Florida Poison Control Centers have collaborated for years to promote poison prevention among individuals with autism. We've created magnets, cabinet safety, child resistant locks, medication lock boxes, and they all have the poison help number. And in the bigger the magnets and the medication lock boxes have like poison prevention for children with autism. So it's a really good resource. So many people also have heard of the poison control centers, but they might not know exactly what they are or what it is. And so it's sometimes we're events and people don't really know what they are.
Yeah, I'm sharing the screen right now, if Olivia can put it up, just to show our audience our safety kit and some of the stuff you said that we collaborated in before. And this is the safety kit that we provide through CARD.
Lisette, to continue in that same topic, can you explain to us what poison control centers are?
Yes, like that's that question. Like some people are confused and don't really know what they are or the services that they offer. So there are institutions that are part of a national network. They offer guidance and advice from healthcare professionals with experience in toxicology through the phone, right? Through the 1-800-222-1222 number. Each call is answered directly. It's not an operator. You're talking directly. The person that picks up the line are nurses, pharmacists, and physicians who are certified specialists in poison information with the acronym CSPICE. They receive extensive training in toxicology and the management of potentially dangerous exposures and work under the supervision of toxicologists. The service is free. Is confidential, is available 24 hours a day, 7 days a week, 365 days a year for poisoning cases. And I say 365, so even during holidays, people might think, oh, they're closed on Christmas or New Year's Eve or New Year's Day. No, it's always open. It never closes. Even during natural disasters, they're open. So these cases, these poisoning cases include medication errors. Those are the top ones. Overdoses, exposures to cleaning products, chemicals, pesticides, herbicides, vitamins and supplements, plants and fungi, insects, spider stings, snake bites, contacts with marine animals, exposures to carbon monoxide and other gases, cannabis, nicotine, vaping product, food poisoning, and as well as ingestion of batteries, magnets, seeds, and other small objects. So the centers are located, most of them in hospitals, like we're located at Tampa General Hospital. So they're in level 1 trauma centers and they're affiliated with medical universities. There are 53 poison centers throughout the United States. They're all accredited by the American Poison Centers. And they're all connected, all work through the same number, the 1-800-222-1222. Florida is such a populated state, so we have 3 poison centers to try to keep up with the calls. So they're located in for the North Florida area is one in Jacksonville. We have one in Tampa for mainly Central Florida, and there is one in Miami. But families only need to remember one number, 1-800-222-1222. An important point we want families to understand is what is a poison? Sometimes they think of, oh, something like a cold drink, like creating a brew like from witches or something like sinister like in movies or Halloween. But a poison is any substance, solid, liquid, or gas. It could be from living things, plants, animals, or non-living, like that could cause harm if it's used the wrong way, the wrong amount, and by the wrong person, and causes harm, right? It causes an injury. So in toxicology, we have a well-known phrase that says the dose makes the poison. So this means like almost any substance can be harmful under certain circumstances. So including medication, vitamins, household products, and even substances we use every day. For example, all living things need water, but if we over drink it, too much in excess, it could cause harm. The same with salt. We cook with salt every day. We put salt in the food, but in excess, it could cause harm or even death. So our services, this is another common question that when we're doing outreach and we're at an event or doing a presentation, it's a misconception. Our services are available for all ages, from infants to older adults. Many people think poison control centers only help children, and this is probably because half of our calls involve children. But most toxic substance exposures among children occur under children. Excuse me, it's like jumping from one Facebook Live to another one. Let me have a quick sip of water. Under children of 5, and it's absolutely normal. At this age, most of their learnings is exploratory. Their environment, they touch, they smell, they taste, they put things in their mouth. That's what puts them at higher risk. And furthermore, they do not understand danger or the consequences of their actions. They don't know something might itch or burn or hurt, or make them sick, or make them throw up or give them diarrhea. So that's why it puts them at a higher risk of poisoning. Also, children, this is another important thing I want to share, is that they learn by imitation. So therefore, if someone in the household takes medication regularly, it is advisable to do so out of the children's sight to prevent them from trying to copy that behavior. Or the same applies if a person in the house smokes, or also be aware if you're cleaning, they want to try to help or copy you. So always keep whatever product you're using close, even if you're going to use it several times, or if you're using a spray bottle, put it up and away so they don't grab it, hit the nozzle, might get it in their eyes. So a lot of accidents also happen while the product is being used. Mm-hmm.
Those are all very good points. I did also want to encourage, like Lisette, I did share that number. I can share it back again on the screen, please, for the number for the poison control centers, to please put that into your phone right now if you haven't already done so. So my next question, God forbid this happens, but what advice would you give to any parent or caregiver who suspects their loved one, whether they do have autism or not, may have ingested something dangerous?
Yeah, we get those calls. Like I say, half of our calls are children. And I understand as a mother of 3, they're adults now, but it's very scary, and you might get hysterical, scared, it's the most loved treasure you have, your children. So try to stay calm. Remove any remaining traces of the substance. If any pieces, like for example, if they were pills, any pills or broken pills or dust from their mouth, you might take a wet washcloth and wipe the mouth, the tongue, the gums, or if it's something spilling on their skin, on their arms or legs, wipe it off. take off their clothes if the substance is soaked on the, like me, I'm wearing long sleeves. If something's soaked, remove that piece of clothing, and keep the container and product handy if possible. Because and do not induce vomiting. That's a big one. Do not induce vomiting. It could cause more harm than help. It could even cause death, especially with hydrocarbons like gasoline, kerosene, like the tiki torch fluid. So those are very dangerous products. And call the poison help immediately at 1-800-222-1222. The poison specialist will assess the situation and provide specific instructions. Some people are asked, that's another question, they ask, how do I know, should I call 911 or should I call poison help? Call 911 immediately if the person is unconscious, if it's having a seizure, fainted, it has difficulty breathing, for example, or is unresponsive, like I said. Any other calls, call the Poison Control Center or the Poison Help number. Sometimes we get the dispatcher from 911 would transfer the call. It's very common to the Poison Center. So I also want the audience to know that all the calls are confidential because we comply with HIPAA, medical private laws. Is like the PHI, your personal health information, the same regulation, like your information, your health information is not shared when you give it to your doctors. They don't share with anybody else, or when you go to the hospital. The same law applies for poison controls. So it stays with us and is protected. Most of the cases are handled entirely over the phone. So when someone calls the 1-800-222-1222 line, the call automatically routes to the nearest, your local or regional poison control center. Usually is by the area code on your phone. So, for example, in our Tampa Bay area, 727-813 would be to the Poison Center in Tampa, but it's the same number. When someone calls, we also get, Puerto Rico is also covered under the Poison Help Services, the U.S. Virgin Islands as well, just to give some examples of how wide the coverage is. And so when people call, the specialist gathers important information to assess the situation. They would ask what substance was involved. That's why it's good to have the product handy. Remember I mentioned earlier, or the container, the amount, how much was ingested or how much was spilled or what area. The route of exposure, that means if it was ingested, like swallow orally, if it was inhaled, something like they breathe in. If it's dermal, it's like something that spill on the skin or a bite or a sting. Or if it's an eye exposure, the patient's age and the weight. We've seen situations that they might not know the weight. They would guide them. Is there a scale in the house? Weight the person, so they could calculate if the exposure needs further, to go to an emergency department and things like that, or the treatment recommendations. They ask for the current symptoms, like what are they feeling now, the time elapsed since the exposure. This happened just 5 minutes ago, or this happened in the morning, or at 8 a.m., or yesterday, or 2 days ago. Situations like that. And any relevant medical history. For example, a common one is like people, sometimes they're cleaning the bathroom or the kitchen and they think they want it cleaner and they mix different products. They might mix Windex or glass cleaner with some ammonia, and it might create some toxic gas. So if the person on top of it is asthmatic, or Clorox, yeah, I mean they make like an atomic bomb. So if the person has any respiratory problems, that make the problem worse. So that's why they want to know any relevant, or if they took a medication, but they're taking some other medication, there might be some interaction. So they will guide the person through these questions. So they have a database of over 500,000 substances. They have treatment protocols, and they have the clinical expertise. I mean, they're the experts, and the specialists will assess each situation and would determine if the patient could safely stay at home following their recommendations that they provide, and they do follow-up calls, or if the person in more serious situation, they need to direct the person to an emergency room. They will they consult directly with the emergency services, the physicians, nurses. They would provide treatment recommendations to the hospitals. They will fax the protocols if it's like a coral snake bite, the antidote, the whole management, or if it's like acetaminophen overdose. I mean, they would fax those protocols. They would have a consultation, physician to physician, of the whole course of treatment. And they monitor the case during the hospitalization. So it's pretty complete service. But besides that, there's even more. In addition to these services, poison centers, they also collect data, and to a national system. It's called the National Poison Data System. These helps detect any emerging trends relating to poisoning. They support public health surveillance. So if there is any public health threat, this information is shared with the FDA, the CDCs, the DOH, and they collaborate on emergency and disaster preparedness and response. So it could be like now with the World Cup, there are like systems in place that the general public doesn't see, but if there is any chemical threat or any communicable substance that would harm the public, so there are systems in place behind for protection, or if something happens, what to do. So the services, like I said, is the general public, but also hospitals, emergency rooms, clinics, medical offices, pharmacies, businesses and workplaces. We get calls from businesses or industries. There's a chemical spill or something they call, or any other exposures, they call the poison helpline. We also get calls from emergency personnel like paramedics, first responders. So help, like I said, all ages and everyone.
And Lisette, why is poisoning prevention especially important for people with autism?
Very good, Jasmine. So every child is unique, but children with autism are at higher risk of poisoning. Some children with autism might exhibit characteristics that increase this risk. These characteristics could be an intense curiosity for exploration, impulsive reactions. They might want to grab something or drink something or smell something. They have difficulty recognizing dangers. They might have attraction for colors or certain textures or smells or tastes. They have sensory seeking behaviors, and very common too, they might have that oral stage that neurotypical children might have, when they're teething. The children with autism, that oral stage might be prolonged or permanent. Even when they're adults, they still have that oral stage, putting things in their mouth. They might have a condition called pica. So it's a disorder that the person repeatedly eats non-food items. Common examples could be dirt, paint, small objects they could put in their mouth, soap, hair, stones. So this pica increases the risk of poisoning because some of these substances might contain, like old paint, in all homes with old paint, might contain lead. Some other substances could have chemicals and bacteria or other hazardous materials. So these for all these reasons is why the risk increases. Also a risk of choking. It could, an object is blocking the airways, or an intestinal obstruction. So communication barriers, they might mean nonverbal or difficulties communicating. So it makes it harder to tell if a child has been seriously exposed. And lastly, elopement or wandering behavior. So you might have a very safe environment at your home, but they might go elope and go out to another place or outdoors. That control is, your safety precautions are not under control, like you have
And I would add to that it's not only elopement. Also, we're getting ready to we're getting closer to the holiday season. So, like in November, Thanksgiving, we go and visit, and Christmas, we go visit other people's homes. So that's another risk right there. We might not think about it, but it's also increases the likelihood because we are outside of our safe environment.
That's an excellent example, Lourdes. Yes, and any time that there is a break in the routine, like you said, there are visitors, or we're visiting somebody during the holidays, or a birthday, or hurricane season, we might have to leave the home, go to a shelter, or people might be coming to your house. Your senses are not focused on, that's why it's good to have a plan. And there are educational materials for those situations. We have one on during hurricane season, how to prepare. And but that was a really good example. Children are curious. There's something called the grandma's purse syndrome. It could be this grandma's. It could be any visitor. They come, their backpack, they put it on a couch or on the floor, and the child might come and look what's inside. So it might be a pill box, or a vaping pen, or edibles with THC. So you name it, cosmetics, hand sanitizer. So they're curious. So just be mindful when you have a visitor. That's why, have those medication lock boxes. Hey, mom, put your pill box in this box, or things like that. But in understanding the child-specific behavior helps families develop an individual prevention plan, with children with autism. And you guys are the experts on that field, not me, but sometimes they use cards with colors or things that are safe or not safe, things like that. So in the houses, inside their home, your home, everybody's home. So common household hazards include, of course, the prescription and over-the-counter medications as the top number one. Vitamins and supplements, especially, they're very dangerous if they contain iron. Cleaning products, laundry detergent pods, they're very concentrated. Hand sanitizer, essential oils like scented, like those plugins that we put, or diffusers with the reeds. Cannabis and THC edibles, nicotine and vaping products, alcohol, batteries, pet medication. Sometimes we don't think, we're talking about human medication, but sometimes we have pets and they have their own medication. So if we have to put them up and away too, and safe places out of sight. And hydrocarbons, gasoline, kerosene, tiki, torch fuel. And so that's why it's so important to remember that almost any product can be dangerous if used incorrectly, the wrong amount, or by the wrong person. So poison centers help with exposures related to pretty much anything, living, non-living, if it's used the wrong way, the wrong amount, or by the wrong person. So prevention begins by identifying each individual's specific risks and developing appropriate safety strategies for the home or in the school or any other environment. So
Yeah, and I love the idea that you shared about prevention, yeah, especially as a public health professional. But yeah, that's always what we want to try and aim for first. Um, is there anything else that you'd like to share with our audience?
Of course, Olivia, there are many things. I could talk forever, but we only have limited time. So, most important message that I would like for the audience is that they save the poison help number, the 1-800-222-1222 in their phones today, like right now as I'm speaking. Take your phone and save the number. There is a QR code that Olivia gracefully is putting in the chat box, and it has a dual purposes. You know, if you scan the QR code, you get the number directly on your phone. You could save it, and it also access to their Florida Poison Control Center's website. It has a plethora of information. It has many tabs. It has a rotating screen that is current. Like now we're in hurricane season. Things that are current. It has recall products. It has a tab for very important tab for educational materials. So it's on poison prevention, different topics for different ages or for the whole family as a whole. On poison prevention. And also, most of our materials are bilingual in English and Spanish. And I also would like, please, please, please always read labels before using any medicine or household products. Always read, check for the active ingredients, check for the dosing, check for the frequency. Also, keep all medications, including over-the-counter products and vitamins and supplements, prescription medication, and like I said, over-the-counter, out of sight, in high places, out of sight and out of reach, and preferably locked away. You could use them cabinet resistant locks, and I say resistant, they're not childproof. There's no such a thing as childproof. It just slows down the process. Or on the medication lock boxes or bags, there are bags available as well. And children could climb, so nothing replaces human supervision. All these are layers of prevention that we use. But nothing. But of course, we have to go to the bathroom. We have to sleep. We have to answer the door. We have to cook. So we cannot be 24/7. That's why these other additional layers of prevention help slowing down the process. Keep food and drinks. This is another tip. Food and drinks separated from medicines and cleaning products. Some cleaning product might have a label, a picture of an orange or a lime or a lemon on the label, and a child or even an adult might think, oh, that's lemonade or that's apple juice, or they might look alike. You know, like a lot of pine Sol cleaner might look like a container of apple juice. So keep them separated to avoid. Never transfer any medicine or any other product out of its original container. For convenience, some people might put bleach. They're going to the laundromat. They don't want to carry the heavy gallon of bleach to do one load of whites. Then I'm just going to put a little bit of bleach in a water bottle, and it looks clear, colorless. I might think, oh, it's water. So a lot of exposures happen like that. It could be 100% preventable if they follow these tips. The same with medication. I might put it in a bag, in a Ziploc bag, in a TikTok container, just because they're going to use it later and they don't want to carry the whole container. So for convenience, but that's why, there are these locked boxes that they could put it in.
Yes. And I wanted to say to our audience, if you can share it again one more time, that if safety isn't a concern, and it is a concern for everyone, but if you have a specifically high the concern for your family, CARD and the Poison Control Center have developed this safety kit that we can help share with you, families. Just contact us, register with us, let us know your safety concerns, and we will be able to make these available to your family. And for those who are registered with us and, and have an autism diagnosis, because that's what our funding is for, our autistic population.
Yes, that was a great collaboration that we did. And those are excellent resources, Lourdes. Thank you for sharing that again. Another tip that I like to add, that this reduces the medication accidental poisoning dramatically. It's to properly dispose any expired medications or medications that you don't no longer use. There are different ways of doing it. There's a twice a day DEA medication drug take back day. It's usually the third Saturday of every month not every month, excuse me, of April and October. You don't have to wait to those dates of the general take back days. There are other ways of getting rid of these unwanted medications. There is a link that Olivia will gracefully put on the chat box of is to locate your nearest medication. That's all year round. A lot of pharmacies have it by the pharmacy department, by the counter. It looks like kind of like a mailbox. There are other products in the market. So depending on your situation, if you have maybe younger kids that might get into the trash, you don't want to dump it in your trash can, or pets that might flip it and eat it. So depending on each family situation, there are different ways. So you could call the poison center to ask for different, options or advice on how to get rid of them.
And you shared with us before, sorry to interrupt you, but you shared with us that the poison control is available to solve. What was the percentage that you shared of how many of the calls that you receive can be solved over the phone?
Over 80% of calls could be safely handled over the phone with the help, with the advice of the experts, without having to go to a doctor or to a hospital. So always give us a call first.
Yes.
Unless you're having those emergency symptoms like the 911 I mentioned earlier, the person is not breathing, has chest pain, is unconscious, yes, call 911. But the others, just give us a call first. And they
I'd
would
love to say that, because that was impressive when you said it on our previous. That 80%.
Yeah, especially when it's like children involved, it's normal that we panic, and it might be something that is non-toxic.
Yeah.
Or not a poisoning exposure to a level. Maybe it's a dose that is a safe dose. It doesn't go into a poisoning dose. So that,
And what are
we collect that information. Yes.
What are some of the most common questions that you get? Is, let's say, if a family we're calling because they have a questions, but perhaps not an emergency.
Very good. Yes, and thank you for mentioning that, because it's great that people would call before a poisoning happened. So poison centers are also for information. So it could be I'm on this medication, I'm taking, let's say, this antibiotic, and I want to take this supplement. And is it safe? Is there going to be any interaction? Is it going to take the efficacy of the antibiotic? Or so it's hard to tell. That's why when you go to a doctor, they ask you, what are you taking? And you only think of your prescription medication. You don't think of all over the counter. And sometimes even teas or herbal supplements might interact with that medication. So disclose always that information. So we get calls like that. We might get a call like a parent, oh, my child has a fever. I gave him Tylenol 2 hours ago. He still has the fever. Is it safe to give him another dose, or is it safe to give him Advil now? So those are examples. So the exposure hasn't happened. It's for information. Or how to get rid of this medication I have. I have this inhaler, or I have these whatever X medication that is expired. How can I safely get rid of it? Or I have this plant, and my baby that was crawling now is starting to walk, and I don't want it to eat a part of the leaf or grab it or touch it. I don't know if it's toxic. give the name of the plant, and they would be able to tell you if it's a toxic plant or not, or what could happen if, if it's eaten, or if they break a piece and the sap gets contact with the skin or the eye. They will be able to give that information before something worse happens, if it makes any sense.
Yes. And this is why we wanted to bring this program. You have shared with us so much information of things to think about that we may not have thought about in the past. For example, the thing about the plant and about other consideration of household items that we may not have even thought about, like the diffusers and something like that. So this is why we wanted to let you know there's plenty of resources that we've shared today. And we want to thank you for bringing that to us. And also, I know that we're going to be sharing a survey that you have on the column, on the comment section. Can you explain to us the importance of filling that survey?
Yes, it's one of to meet our deliverables, and also how we could improve our presentations. On the comment box, you could also, if you want to hear about any other topic, or if you want to contact us for give a presentation to your school or your institution, or any training on, let's say, on Narcan, or whatever topic. Sometimes we go and give presentation to Girl Scout clubs or to Safe Kids coalitions, or it's like I said, it's many different things. So these surveys is anonymous. We're not going to know who did it. You don't have to put your name. It's for us to improve, and also is required by the Department of Health, the DOH, for to meet our grant deliverables. So I would appreciate if you take a time. You could save it. You don't have to do it right now. Save it and do it later, or do it now if you wish.
Yeah, that's wonderful. And we are running out of time, but I wanted to make sure that we covered any questions or comments if we had them.
We don't have any questions at this time, but I did also want to say thank you to Kyle Hume for giving us some love with liking our show. Thank you.
Thank you. So, like I said, we're up to the end of our show, but I wanted to thank Lisette for bringing us such valuable and important information. Again, we have shared the links that she was talking about and more on the comment section. So if you have any questions, any comments, any ideas for us to perhaps create another show in the future, like Lisette just mentioned, if you want to change the topic, we'd love to be able to help do that. And if we do create another show with your idea or comment or question, we'll make sure to give you recognition and on the air, so that everyone knows where that came from. So thank you, Lisette, for being here today. We really, really appreciate it. This is beautiful information that now remains on our channel, on our YouTube channel, for those of you who want to come back and listen to it, perhaps with more time, or share it. So be sure to go into YouTube. Our page is Card USF, so be sure to do that. So thank you, Lisette. Gracias.
Well, thank you, Lourdes. And thank you, Card USF, and Olivia and Jasmine. Thank you for inviting us.
Yes, I'm so glad that we were able. And I just wanted to remind our audience that we come on the air the third Friday of the month, and the next time will be August 21st, when we will be talking about elopement prevention, another safety topic. So be sure to be here with us. And that brings us to the end of the show, though. But just like you said, just ask for your help with that survey. We also would like to share our survey with you. This is the way that we can remain on the air. Let us know how we're doing. Let us know how we can improve the show. Let us know if what we are doing and to create this programming to be here is as important to you as it is to us. And this is the way we are able to stay on the air and do that. So thank you ahead of time for filling out both. This time around is 2 surveys, Lisette's survey and our survey. And even if you've done it before, we need it one more time. This is the way we can remain on the air to bring you programming like this. But now that brings us to the end of the show. I would like to remind you to give us a like, to share this video in particular on your page and with all those that you know could benefit from this information, and meet us here the 3rd Friday of the month at 10:45-ish a.m. next time being August 21st. But until then, we would like to wish you good vibes and hot coffee. See you then. Have a great
Bye,
weekend,
everyone.
everyone. Bye-bye.